Good morning, I'm Pamela Miller, and I am here to discuss with you the roles and responsibilities of nurse educators. Nurse educators have many roles, including education and preparation for the instructor, preparation of the curriculum, evaluation of the teaching methods, and to monitor and coach the students. Other responsibilities they may have could include research and other ways to facilitate learning. Nurses are educators, and they have many roles, and the education of the nurse is the utmost importance to meet the requirements of the job that they hold. An example would be that a nurse educator that teaches the licensed practical nurses at that level may not need to have the educational background required by someone who is teaching nurses at the BSN level. The LPN instructor may have a BSN degree, but the BSN instructor may need to have a master's degree. The individual educator has the responsibility to obtain those necessary credentials. Education preparation is necessary for the standards of practice. Nurse educators develop their curriculum according to the current standards of practice and the philosophy of the institution for which they are employed. The program that is prepared must meet the expectations for licensure and equip the students for the ultimate goal as working nurses, according to Oberman in 2015. While some nurse educators work in classroom settings, others work in clinical settings, and each of these provides different ways that nursing could be taught. So different positions also hold separate job descriptions, and according to Oberman, may depend on the college or the facility on which we are employed. To evaluate their teaching for nurse educators is very important, and those objectives must be met for licensure and for the effectiveness of which they were teaching. The future nurses require certain information, and according to Bastable, they also we must be conscious of providing the education for the best possible outcome. Nurse educators can work in the hospital settings, and they can work with patient education such as diabetic teaching. They can teach courses that are required for nurse continuing education such as NRP, advanced cardiac life support, pediatric advanced life support. These jobs are very important for the continuing educations of nurses. The student that is taught in the classroom and proceeds to the clinical setting is going to need some information specific to the job that and skills that they are needing. The nurses in the clinical setting can seek opportunities for those students and give them some confidence with practicing some skills that they've learned in the laboratory setting. At Benedictine College, the nurse educators work closely with the students and help promote innovative and educational practices and active teaching learning relationships that are centered around collaborative problem solving in their discovery program. Last year, 2 of the students and the director of the department collaborated on a poster project for educational intervention in diabetes. Through this, the students were supported to face a question and establish a cooperative means to problem solving. Other responsibilities for nurse educators may be to perform research, to be in leadership. These nurse educators need to work with their institution to follow the expected outcomes according to Oberman, and participating in professional organizations and qualities management may be another source of a role or responsibility for a nurse. Thank you.